Hello, I am Dr. Sujoy Dasgupta, consultant in reproductive medicine and clinical director of Genome Fertility Center, Kolkata. Many a times, the couples who are trying for pregnancy or who are suffering from infertility, they want to know, doctor, will my embryos be normal genetically? The answer is, the way by which we can check it is called PGT or Preimplantation genetic testing. It's basically checking the embryos before we are transferring the embryo into your womb. Of course, it requires IVF because without IVF we can't form the embryos. But the advantage is that before you get pregnant, you want to know whether the embryo which are there inside your womb will be normal or not. It can be done mainly for two reasons. Number one, when you are suffering from infertility and you are going for IVF and you want to know whether the embryos will be genetically normal or not. Number two, even when you don't have infertility but maybe you are having some genetic issues but you don't have problem in conceiving, still you want to have healthy baby, you want to conceive with healthy embryo. In that case, we can check the embryo before pregnancy and we can assure you whether your embryos will be normal or not. How PGTs are done? It's basically the procedure of IVF, that is, eggs are collected from the wife and sperms are collected from the husband. Then in the laboratory, embryos are formed. Then embryos are checked for any genetic problem. That is, some cells from the embryo are taken. The cells are taken from blastocyst stage of the embryo, that is, at least from day 5 or day 6 of the embryo. That is, embryo's age should be 5th or 6th days after fertilization. And then the embryos are sent to the labs and the labs will tell whether the embryos are genetically normal or not. Only the genetically normal embryos will be preserved and will be transferred. If they are not genetically normal, they will be discarded because there is no use of transferring those embryos. They will not give rise to pregnancy and rather they can have some genetic problems and babies may be abnormal. And there is no use of freezing these embryos who are genetically abnormal. But there is some new advancement by which you may not require biopsy. This technique is something called NiPGT, non-invasive PGT. That is the medium where the embryos grow. We can collect some of the fluid from the media because this fluid often contains some of the DNAs of your embryos. These embryos can be tested in the laboratory and the laboratory can tell whether the embryos which are tested will be genetically normal or not. Now, there have been 3 types of PGT, pre-implantation genetic testing, 3 types and 3 types of couples who can be benefited by these different techniques. Number 1 is PGT-M, pre-implantation genetic testing for Mendelian Disorders. That is, sometimes you can have some genetic problems like Thalassemia or Cystic Fibrosis or some other diseases like spinal muscular atrophy. These are lethal diseases. Either the babies will be abnormal or handicapped, or for thalassemia, the baby will require repeated blood transfusion. Definitely, you don't want to have this type of babies. So what we can do? We can check the embryos, whether the embryos are genetically normal or not, and only the genetically normal embryos will be transferred inside your womb so that we can prevent the birth of a genetically abnormal baby. There is number 2 technique that is called PGT-A, pre-implantation genetic testing for structural rearrangement. What is this? There are some couples who are suffering from infertility, particularly male infertility, severe male infertility like azoospermia or very low sperm count, or some women who are undergoing repeated miscarriage. In that case, there may be some abnormalities in the chromosomes of either of the parents, father or mother. If the embryos are transferred inside your womb without testing, these embryos may be genetically abnormal. That can cause miscarriage or the babies may be abnormal, handicapped, or there are multiple physical and mental problems. In that case, the embryos can be tested whether the embryo inherits the genetic problem, that is the chromosomal abnormalities or not. If the embryos are having these genetic problems, chromosomal rearrangement, these embryos will not be transferred. Only the embryos who are free from genetic abnormalities will be transferred. The aim is to reduce the risk of miscarriage and to ensure to have healthy baby mentally and physically and of course genetically. There is another technique for PGT that is called PGT-A, Preimplantation genetic testing for aneuploidy. Suppose none of the partners are having any genetic problems. Both the partners are genetically abnormal. Still you can have miscarriage, still you can have IVF failure, repeated IVF failure, right? We don't know the cause. This is particularly common if you have 3 or 4 times IVF failure, or when the age of the woman is on the higher side, say around 37, 40 or more, or if there is severe male factor problem, severe problem in husband's sperms. In that case, there is chance that the embryos may be genetically abnormal. That's why these embryos are not getting implanted, that is, these embryos are not giving rise to pregnancy, or these embryos may be miscarrying. In that case also, these embryos can be checked for genetic abnormality. This is called PGT-A, and only the healthy embryos will be transferred. The aim is to increase the chance of pregnancy, to reduce the risk of miscarriage, and to improve the chance of having live birth. And it's also economically viable, because if we don't check the embryos, we have large number of embryos which we need to be preserved. But if we know that yes, these embryos are normal, we will only preserve these embryos, we will not preserve the abnormal embryos. So this is something called PGT, pre-implantation genetic testing. But again, in this case, the role of laboratory is important, because in which laboratory the sample is sent is important, because you are spending money for it. That's why we recommend MedGenome, our trusted brand. We are regularly sending the patients samples in this lab, so we strongly recommend you to consider MedGenome for PGT. Thank you very much.